Welcome back to Movement Professional. So today I'm going to demonstrate two exercises to work on hip abduction, strength and mobility. So the first one I'll do is a standing straddle position, and I want to use the pillar here to give me a reference for posture. So whenever we're looking at improving joint mobility, I want to think about three things: posture, which would be the idea of head over ribcage over pelvis. Then I want to think about the direction in which I'm moving, and then I'm going to add the breath into that. So the direction in which I'm moving is generally towards abduction, external rotation, in as much of the frontal plane as I can. So I want to use the idea of the pillar here to give me a sense of posture, so I can feel the back of my head, space between the shoulder blades, and then the back of my belt or base of the sacrum on the pillar to start. And then I'm just going to start moving away from that. So when I move my feet out, I don't want to move them forward too much. I want to keep this idea of keeping the reference for posture and then start to inch my feet out, make that adjustment, make sure I have the posture. And I'm only going to go out a little bit at first, and then I just want to feel like my legs are reaching long into the ground. I'm going to spread my toes. I'm going to feel the four corners of the feet, inside, outside ball of the foot, inside, outside of the heel. And I want to just see if I can feel my outer glutes. So just thinking muscles that externally rotate and abduct. So I'm feeling those engage, and then I can actually exhale and do the opposite, where I'm sort of squeezing the ground with the inner edges of the feet and feeling the inner thigh. So I get a little bit of reciprocal inhibition there, and then I'll walk a little bit farther, trying not to have my feet go too far forward. So there's constantly a fight for posture. When I inhale, I'm thinking about reaching, feeling the glutes. Exhale, compress, pinch in, feel a little bit more abs, feel a little bit more inner thighs, and then just keep walking out. Every time I walk out, I want to readjust my postural cues into the pillar, and I'm just going to keep going. So I'm building strength in those muscles, but I'm also just getting gradually greater into the range of motion. All right, so some people can go farther than others. That's just the idea of slowly working out there. The key though is to feel strong with it and make sure you don't lose the posture. Oftentimes, if you take yourself away from the pillar, a lot of different things can happen. You won't even realize that you're leaning forward. The pelvis often is going to orient forward, and the spine is going to overextend through there. So having this idea and this reference of where's my head at, where's my rib cage at, where's my pelvis at, and then even if I start with my heels touching, trying to keep in that same plane as I move out, it gives me a better sense of elongation through the whole spine. All right, so now I'm going to do the same concept down in a sitting position. So I'm going to have the back of the head, space between the shoulder blades, back of the belt on the pillar. And here the common compensation is, if I demonstrate this from the side, is really the back of the belt wants to come off. Or if you have a really kyphotic upper back, the head's going to want to come off. So I would prioritize this back of the belt or base of the sacrum area as much as you can. If the head can't get onto the pillar, you don't have to force it, but just try to have it balanced on top of the rib cage as much as possible. But this is the fight, trying to keep that back of the belt there. So oftentimes using the arms, trying to make the arms longer, will help you continue to push into the pillar as you then inch out until you find your first wall, and then you're thinking a little bit of a turnout, an elongation. So when we're thinking abduction, external rotation, the idea is elongate. Try to have thinking of the knees moving away from the hips without the back of the belt coming away from the pillar. So you're going to do kind of the same idea on the inhale, reach, roll out. On the exhale, keep the essence of the reach, but find more abdomen. So you can think about your belt buckle cinching in, ribs coming down, and that's going to think about the ribs coming down would almost push you more back into the pillar. Where on the inhale, I might expand. I'll feel the back of my belt actually move back into the pillar as I get more expansion into the abdomen, into the lower ribs, into the back of the diaphragm, and even into the back of the lungs where the space between the shoulder blades are. And then I'll just keep moving out, use my hands to adjust, do the same thing. The inhale, I'm going to elongate, roll out, feel the expansion into the belt, feel the expansion in the back of the diaphragm. Exhale, ribs come down, pull the belly in a little bit. Think about the front of the pelvis coming towards itself, and then you're going to get a little bit more pressure even back into the pillar. So you just keep taking the legs out, keep going through that breath cycle. All right, so you're thinking posture, breath is going to enhance your direction, and the direction you're going is elongation with abduction, external rotation. Hopefully that makes sense. If you have any questions, you can go to movementprofessional.com. I'll see you next time.